Terrific. Well, welcome everybody. Thank you for joining us today. This is the National Adoption Competency Mental Health Training Initiative, or NTI, Transfer of Learning Tuesdays. And this is the last one that we have on our schedule at the moment. I'm sure we'll be doing more webinars in the future, so stay tuned and keep your eye on our website. Today's online seminar is entitled Applying Key Concepts and Tools Promoting Family Stability. I'm Lisa Maynard, as I said. I'm an implementation specialist with NTI, and I'm joined today by my co-host and colleague, well, actually my supervisor, Dawn Wilson, as well as our co-hosts, our guest presenters, Etta Lappin-Davis, Sharon Sylvia, Susan Cholia, and Michelle Burdette. And they're going to introduce themselves as we go along the way a little bit here. But before we look at today's agenda, if you haven't already, please type your name and where you're from in the chat box, and one thing that brings you joy, if you haven't done that already. So we are going to start here with a poll to let us know where you are. So we have a visual representation of where folks are located. Look at those numbers go.
Take a minute to answer the poll question. And
in today's world, we understand that you don't necessarily reside where you work. As I said, I'm in upstate New York, and working through the Burtonsville office, but mostly all over the country. So great, we've got a real great representation from the whole country.
you want to show the poll?
Oh yeah,
Poll
sure.
results? Yeah.
Yep, they're up, aren't they? Yeah, there we go.
There we go. Yeah.
Yeah. So from all over the country and other. So where are you other folks from? You want to throw that in the chat box? That'd be great.
I know we've got somebody from Puerto Rico. I saw that. That's U.S. territory, but
yeah.
If you're other, please be sure and put in the chat. Oh, here we go. Sorry,
Canada.
British Columbia, Canada. Great. Welcome.
Alaska,
and above the Arctic Circle in Alaska. Hello, Nicole.
Ooh, a brave woman.
Toronto.
Yeah, Canada.
Winnipeg, Manitoba. We got all over the place. So welcome, everybody. Thank you so much.
Yes, thank you so much. Okay, stop sharing. Let's get that off there, and then we'll move on to the next slide. So just briefly, what we're going to cover today, we're going to do a brief overview of NTI. Many of you are names that we recognize, people we've seen on these Transfer of Learning Tuesdays before, but we've got some newbies, so just want to make sure that folks have a good understanding of NTI. We're going to talk about adoption is a lifelong process with ongoing mental health needs, often years after placement. So the challenges don't necessarily end with the day of adoption, right? We want to make sure that we're talking about the lifelong journey. We're going to identify key characteristics of post-adoption work across the life cycle for child welfare and mental health professionals. We want to look at the different types of adoption and guardianship and stability and contributing factors. And our guest hosts are going to share their information about how they've incorporated NTI and the tools and strategies that are embedded in NTI in their day-to-day practice. We're going to give you a little quick introduction to NTI access and implementation options for those of you who have not yet done so, and then questions and answers. And in the presentation from Sharon and Etta and Michelle and Susan, go ahead and put your questions in the chat box, and we'll try to answer them as we go along, and also answer questions at the end as well. So one more poll. We want to know from you, have you taken NTI? And if so, where are you? So go ahead and take a moment to answer this poll.
So are you currently taking NTI? You haven't taken NTI yet. We hope that means you will. You're really excited to start NTI. You've completed NTI, or you've completed it and you're listed in our national directory of trained professionals. And don't worry, if you haven't started NTI yet, you'll have opportunities. So.
For sure. Yeah, I love this number that's growing, that's really excited to start NTI. And the 28% so far who have completed. Okay.
Oh, wow.
So that's great. We've got a great representation here. Haven't started yet? You 43%, we're going to be talking to you about how you can get started for sure. Okay.
Somebody real quick, Lisa, in the chat asked, is the NTI the training course with multiple modules? And yes, it is a web-based training with 8 modules for child welfare, 10 for mental health. And we'll talk a little bit more about that in a second. But
great.
you probably got the right training in mind.
All righty. Very good. Thank you for participating. So the Center for Adoption Support and Education, or C.A.S.E, was created in 1998 to provide post-adoption counseling and education services to families in Maryland, North Virginia, and Washington, D.C. C.A.S.E is a private nonprofit service agency envisioning that everyone touched by foster care and adoption has the access to adoption competence support necessary to navigate the lifelong journey. NTI, or the National Adoption Competency Mental Health Training Initiative, builds on that firm foundation of unique experience and expertise and core values of C.A.S.E. To learn more about C.A.S.E's mission, core values, strategic partners, etc., you can visit our website at www.adoptionsupport.org. Through our work, we've seen the need for change in how we address the mental health needs of children in the Child Welfare Service who are looking to achieve permanency through adoption, guardianship, and kinship. And NTI was funded through a grant by the Children's Bureau to help us develop NTI. Dawn, you want to tell us a little bit about that?
So as Lisa said, NTI is the National Adoption Competency Mental Health Training Initiative. This was started out as a 5-year research initiative funded by the Children's Bureau within the Administration for Children and Families with the U.S. Department of Health and Human Services. And we actually have received federal funding since 2019. The original grant was a 5-year, 2014 to 2019. And we have continued to receive funding to help us with implementation work since then. So the whole idea really behind NTI was to create web-based training for child welfare and mental health professionals that would enhance the capacity of professionals to understand and address the mental health challenges of children and youth in foster care, adoption, and kinship or guardianship families. NTI provides skills, strategies, tools for both child welfare and mental health professionals. It's rich with resources that support children to heal from trauma and loss, provides parents with skills to parent more effectively, and improves child and family well-being to increase family stability. And we'll take a closer look at the 2 different curriculum that we have. So we have a 20-hour child welfare training. It is for child welfare professionals. There's an additional 5 hours of content for child welfare supervisors. And those additional lessons are intended to help support supervisors to support their staff to apply what they've learned in the training in their day-to-day practice. As I mentioned earlier, the child welfare curriculum is 8 modules, a total of about 20 hours. For supervisors, there's also a supervisor coaching and activity guide that can help them to support their staff through either individual or group staffing supervision sessions. And for folks who take NTI on our learning management system, it is currently approved by NASW for 20 or 25 continuing education credits, depending on whether it's the child welfare or the supervisor version. On the mental health side, the curriculum is 30 hours. Obviously, the child welfare curriculum is much more focused on casework practice, right? Work with children and families. On the mental health side, it is more focused on clinical practice, including assessment and treatment planning. It is 10 modules on the mental health side. And the 2 additional modules, they both have the same basic 8 modules, but the the mental health curriculum also has a module on assessment and treatment planning and therapeutic parenting challenges. We also provide information about a number of different evidence-based treatment interventions that can be effective with this population. We're not going to train you in those interventions, but we're going to help you understand how they can support your work. And also for those who take NTI on our learning management system, the mental health curriculum is approved by NASW for 25 continuing education credits. So why do we develop this training? I mean, why would specialized training be needed? Well, we know a couple different things. We know that traumatic life experiences and early losses can create additional challenges and elevated risks for children and youth. Risks that can create developmental, health, emotional, behavioral challenges for them and their families. And we want to make sure that professionals who work with families understand the experiences that they have and how they impact their life, and to help provide the kinds of supports and services that will be beneficial to them and will be productive and effective for them. While we have 2 different curriculum, they are aligned. So what we're trying to do is really create shared understanding between the child welfare system and the mental health system to work together to support families so that they can be successful long-term. If you're interested, really quick, and I didn't mention this a minute ago, in a list of the competencies that this training is based on, you can go to our website and we'll give you that information toward the end of the training. All right, so we talked about these elevated risks and challenges that families can experience, and this just gives you a highlight of some of the challenges that are experienced by families. And I want to take a moment to say that we are not pathologizing adoption. We know that adoption is a significant protective factor for families, and for many families, if not most families, it's a wonderful experience. But we also know that there are families that struggle. So just some things for you to sort of pay attention to. We know that 80% of children who come into foster care have significant mental health needs. We know that 40% of youth adopted from foster care are diagnosed with ADD or ADHD. Sometimes it's appropriately diagnosed, sometimes not appropriately. And there's also a high incidence of prenatal drug alcohol exposure, which of course can also create additional challenges. We know that adoptive families utilize clinical services at triple the rate reported by families formed by birth. And I don't want you to think that we think this is necessarily a bad thing. It may just be an indication that adoptive families are much more receptive and open to, the outside world providing supports and services to them, which is a good thing. But we also know that some of those families experience significant challenges. So we want to make sure that the professionals working with those families really understand their needs. And then lastly, the foster adoptive parents reported 1/3 of their children had emotional problems, and 40% had educational problems. So we, of course, want to make sure that professionals who work with all these families have the skill set that they need, have an understanding of how to be supportive and helpful. We know that problems are magnified by the fact that many behavioral health professionals do not receive adequate training. So it's not like most of these professionals have had specific classes around working with this population. We also know that for all the children who have experienced adoption, they've also experienced loss, right? That's a central part of what every child who's experienced adoption has experienced. And I mean, all of us have experienced loss to some degree, but the losses that children in foster care and adoption experience is very different from the normal kinds of losses that get recognized and acknowledged by the outside world. And oftentimes, because we're focusing on the positive aspects of adoption, we took a child who was in a difficult situation and put them in a better situation, so to speak, we sometimes unintentionally minimize the losses that are experienced by children and their families. And so we want to make sure that we're helping folks really think about what that means for children and their families. So in terms of promoting family stability, so Lisa said this a minute ago, right, that this is a lifelong experience. The problems don't go away when the child's adopted, right? Children come into their homes with their life experience and whatever challenges they had prior to adoption. So do parents. And so we want to make sure the families are supported. So the focus really of today's webinar is around not just what we can be doing around promoting family stability, but how some of our partner agencies, folks who have utilized NTI, are actually doing this work, using NTI skills, tools, resources to help in the work that they're doing every day with families to promote family stability. So I just want to point out too, we talk about disruption rates and you know, we're not necessarily focused on that because disruption can look lots of different ways for families, but we do know from studies over time that the overall adoption disruption rate is anywhere between 6 to 11%. We also know that adoption competent mental health services can make a difference for families. And that's really sort of the genesis for why we're doing this work and why we believe specialized training is important. That we want to make sure that you as professionals have what you need so that you can provide supports for families to be successful. So with that said, our guests today are going to talk about their own experiences in utilizing NTI. And we're going to start with Michelle Burdett and Susan Such with the California Department of Social Services. So Michelle and Susan, I'm going to let you take it away.
Good morning. So my name is Michelle Burdett and my coworker Susan Such is here with me, and we're with the California Department of Social Services, Adoption Services in Chico, California. So briefly, we're going to talk about who is CDSS, who do we serve, what helps in adoptive families to create the stability that we're looking for, and how we have implemented NTI in our office. So the California Department of Social Services branch provides adoption services for kids from foster care, as well as kids who are being adopted through the independent adoption process. And our office also contracts with counties in order to complete family assessments for the Resource Family Approval Program. And that is a program that is how foster parents get approved. And it's a one-stop approval for guardianship, foster care, and adoption. So our office is one of 6 regional offices, and we all report back to the headquarters in Sacramento. Our particular office has a manager, 2 supervisors. There's 14 adoption specialists here. And I saw a few of our friends from the Arcade office have popped on, so that's pretty fun. That's it for this one. So this is a little bit older of a picture and kind of hard to see, but anything in yellow, that's what our particular office here in Chico covers. So clear up to the Oregon border. The things that we really find important to promote family stability, we work hard to ensure proper matches between adoptive families and children, that we really prepare families and the children for the adoption process, starting, you know, with concurrent planning all the way through post-adoption, and then like on the bottom, post-adoption services. So we usually really like to make sure our families and people who work with our families know that there's no way around the fact that adoption is trauma. Parents raising adopted kids really need to have a good grip on their own trauma history and really be able to be solid and open to the trauma history of the children that they're parenting. And part of how we do that is we really, we include an ACEs quiz, the adverse childhood experiences. We include that in a training that we do, and adoptive parents fill that out for their own information and help them learn what the significance of that means. And Susan You had a little bit to say on that slide, right? Except you're muted.
Yeah, I wanted to say something about the last slide about trauma. Our office thinks a lot about promoting family stability over the long term. And we've identified a couple of ways of working with families and children because we want them to remain firmly planted in their families for their whole lives. And we want to lessen the potential for dissolution and disruption. So one way we help children to become more conversant with their history and to address their own adverse beginnings is the life book. So many of you have used these life books. We have stacks of them at our office. Some people use a storyboard, or Michelle, I know you use a roadmap. But this is something that we use pretty often. And I used to start at the beginning with the life book with children and families. And then I read in the NTI training an article by David Brodzinski titled, let's see, Understanding and Treating Adoptive Families, in which he describes in his private practice how he uses a life book. And I decided to kind of follow his lead. And so now I don't begin at the beginning of the life of the child. We begin in the middle. And there are several advantages to that. And I'd like to just tell you kind of about my experience with that. When I started in the beginning with a life book, I noticed that children were often sort of puzzled. Of course, you know, they didn't remember a lot and they might be uncomfortable. And then the adoptive parents were uncomfortable too. They were a little bit avoidant and maybe even a little resistant. So it didn't turn out to be a really positive experience. However, starting in the middle turned out to be a way positive experience because think about a child in a prospective adoptive home. There's so many new beginnings. You know, they might have a new bedroom, new clothes, their picture is all over the house with the family, new pets. There's a new name possibly after the court hearing celebrations. There's a lot of actually positive things going that reflect well on the adoptive parents, because it's a way of showing and recording everything they're doing together that they're doing well, and it gives the child a chance to kind of objectify these people that are supporting him or her now and in the future. So you think about the starting of the life book in the middle. It's kind of like the daily news that you're reading, what's going on now, and it's also oriented toward the future. So we're naturally starting to plan our lives together, and we're putting our plans and expectations in the life book as well. Okay, so over time then, as the child feels safer, emotionally safer, he or she will begin to fill in that background that is part of their story. And yes, that's why we're doing it. They need to know their story. I had a 7-year-old on my caseload with autism, and what he said repeatedly was "Grandpa" and "blue house." Grandpa, blue house. So we knew that that was positive for him, and so that went in the life book, and that was not much, but it was something. Okay, and so we know that children with adverse childhood experiences have lots of memories, and some of them with their birth families are positive. Those have to be captured in the life book as well. So any memory that they hold in high regard is protective. All right. So because kids have lost so much, they're at a pivotal point in their life story. You know, they're starting over, and yet they've got all of this history. So just to close on this, I was reading recently about in the memorials for the 9/11, and I noticed that the World Trade Museum has a saying called or a question kind of, what's your 9/12 story? And I thought, hey, that's really important for a child who's being adopted, because you know, they don't have, the message is they don't have any control over something horrible that's happened to them, but they do, with help, have the opportunity to build a future that's resilient, and they rely heavily on the adoptive family to do this, to develop that resilience and strength. And so, but it helps the kids to manage and thrive. So when we introduce the life books to families, we know that it's a lifelong project, lifetime, and it's not a short project, but they'll work on it together and they'll grow closer together. That's our hope.
Okay, so one of the things that we find is helpful is in assessing families when we're actually matching children, or even when children are already in the family. Of course, parenting experience parenting children with trauma is obviously helpful. We really dig into a family's self-awareness, like what do they know about their own history, what are triggers for them, what might be hard for children coming in, how are they gonna, I see this a lot, you know, with sexual abuse cases, where if a person has had a history of that themselves that's unresolved, or they haven't done therapy around it, and then a child is placed in their home that they didn't know had molest history or sexual abuse history, that can be really triggering. So any type of self-awareness, that's why it's good to do a deep, thorough assessment of a family. Families who really have an attachment focus to their parenting is helpful to kids, because that's what they need first and foremost. You can't get anywhere down the road if you haven't done a real good attachment with the child to the best of the child's ability. When I talk about attachment, families don't necessarily always know how to frame that, and I tell a quick story about if anybody's ever been to the beach. If you've taken, I grew up on the coast, so if you take a starfish off of a rock, it loses some of its little suckers, and you put it back on and it will reattach. You take it off and it loses some more. And so sometimes our kids have been through this process in foster care for a very long time and had many placements, so their capacity to stick gets less and less, and that really sort of is a good visual for families sometimes. A family's ability to really look behind the behavior. Sometimes things get overly focused on what the kid is doing and not really like what is the feeling that is propelling this behavior. The family's commitment to the child. If we're a year into a placement and the family's like, well, I'm not really sure, if the child would only stop doing this or the child would only be like that, that's very conditional, and that's a huge red flag. And so there's kind of a joke around my office, because I'm always talking about like, well, is this family willing to crawl through glass for this child, like literally crawl through glass for this child, or pry them out of my cold dead hands? That's the kind of commitment we really want to see from a family for the child, because that child deserves it. That child deserves somebody that's going to love them with that ferocity. And it takes a lot. Our kids come with a lot from the foster care system. A willingness to ask for help right away is huge. We, throughout our process, working with families, we're like, please ask, please ask. It's not a weakness. It's not a sign that you're not managing the situation. Like, it's a big task, sometimes helping a child heal through all of this. And so we ask them, please ask for help right away. You're not cut off when the adoption is finalized. Call me, call anybody in our office, call our post-adoption worker. We want to help you. Realistic parenting expectations. I think that it's important that people see each child as the individual child that they are and help them reach their full potential. I guess some of the sticking points that I see with this is when parents are like, have raised children, and then they think, well, I'm just going to do the exact same thing with this kid, and this is how I parent. They need to be flexible with that. And definitely a good sense of humor. If we can't laugh, we're going to cry sometimes. So part of how we prepare families, we prepare them through the transitions and really kind of what to expect. So helping families understand the concept of the honeymoon period, helping kids understand you might have some loyalty conflicts as you go towards adoption between your family of origin, your birth family, and loving your adoptive family. Really, we work hard at structured pre-placement visits. We spend a lot of time with families when a child is transitioning into the home. When we're doing the matching process, we really see how they pick up on the child's cues. Can they empathize with the child? Things like that. Really help families identify their supports. And sometimes it's a tricky transition going from a resource parent or a foster parent to an adoptive parent. If they're used to a lot of agency input, sometimes that's hard to have less agency input. I had to have a chat one time with an adoptive mom, like, you can't put your soon-to-be adopted child in respite all the time. Like, if you have a family friend and you want to get a little break, that's great, but you can't, it's not the same as straight foster care. And Susan's going to talk for a second about the transition for relative placements.
Okay, thanks, Michelle. I picked this one to talk about because we do have quite a few relative adoptions at our agency and grandparent adoptions, right, Michelle? That's pretty common for us. And, when I first started doing these, I kind of thought that a family adoption would be a little bit easier and maybe even more natural because they're related, but actually that was not true. So in the NTI training, I spotted a list of things that relatives face when they adopt, and it included a great number of complexities, issues, like Michelle said, loyalty, divided loyalties. And I realized at some point that families that were previously united may even become divided because of this prospective adoption. So there's a lot at stake. So with this in mind, I began to build extra time into relative adoptions over time, just planning to have conversations with them specifically about their losses. And I do this because I believe relatives need the opportunity to grieve losses that no one else will acknowledge or support. So I believe it's our job to give them this opportunity and to kind of raise the lid on these issues and give them this this chance to share. So I use a framework to do that, and I decided to go ahead and kind of do an example of conversational openers that I use with, I'm going to use grandparents as an example. I use to address losses, the 5 stages of Kubler-Ross's stages of dying. And if you're not familiar with those, I'll just list the 5 as I go. But many of us are already familiar with this because it's also a framework for understanding loss after a traumatic event. The stages don't necessarily go in order, but they're pretty reliably there. So here's an example of talking with a grandparent. For the stage of denial, that's the first stage, and I don't tell them this is denial. I just might say, hey, I guess you must have been pretty much in shock when you learned that your daughter was using meth and that the children went into foster care. Okay, so yeah, the response is typically, yeah, I couldn't believe it. We didn't know how bad it was. There's a lots of expression of shock and ignorance, denial, and have screened it out. So I want to hear that. We talk about that first stage. The second, anger, I might say, I noticed you were kind of sounding angry with your daughter on the phone. What's going on with your relationship with her now? So that's an opening to grandparents really have fury often with their adult children, and the recrimination, lots of finger pointing and blame to go around. And so they might say, yeah, I told her, how could you let this happen? And they're very fiercely upset and disappointed in their relative, their adult children. And they may even say, you're still hanging out with your drug dealer. Well, we're never going to speak to you again. So you could see in those angry statements the beginnings of that division within a family. But you are there to listen and to support that stage of loss. Okay, bargaining. I might say, you and your daughter agreed. Your daughter and her boyfriend both agreed to go to treatment. How did you? How were you able to support and encourage that? Well, that's kind of an opening to talk about all of the promises that are being made during usually the reunification process. Are parents keeping their promise? The adult birth parents to become clean and sober, for example. Grandparents are often promising not only foster care, but for their grandchildren, but we'll pay for rehab and we'll do this, we'll do that. Everyone's trying really, really hard to make this work and going above and beyond to make promises and agreements that will support reunification. It's kind of a last holdout for the birth family to remain intact, and the grandparents are doing everything they can possible. All right, so they will say, yeah, she promised she would go to rehab, and she promised that she would leave that boyfriend, and if it meant losing the kids. And so everyone's kind of still hopeful at that bargaining stage. Then that slides into depression, and I might say, well, when they left rehab and the social worker recommended ending services, was there a point when you stopped hoping? And then you will be hearing about the sorrow. They might say, I knew it was over when they got kicked out of rehab. Everything we've tried to do just hasn't worked. What went wrong? Now these kids don't have parents, and it's really the end of the road. It's a lot of suffering at that stage. Again, you're there to hear it. Okay, you're supporting this stage, this phase of grief. And then finally, acceptance. I might say, how have you managed to come to terms with your changing role from grandparent to parent? What's going better? What does the future hold now for you and your you and grandma and the 3 children? And the parents are, if they're in a stage of acceptance, grandparents, they'll say, well, these children need a permanent home. They need to be safe and they need to be loved, and that's with us. That's a good stage to be in. Now there's positive things to talk about because now we're turning toward the future. We're accepting the reality. And this is a time too to talk more about the children's needs, and that's can be pretty positive. So finally, to finish this, I just want to remind that why do I do this? It's so that the relatives will have an opportunity to grieve loss that no one else has acknowledged or supported with them. That's my hope. And of course, that it will stabilize the family long term. Thanks, Michelle.
Yeah. So a second part of the preparation is we have a 2-day adoption preparation class that we do for all families adopting through our agency. And it's super fun. We've been doing it on Zoom, which is not as fun for me. But when you get to do it in person, it's such a time for families to build relationships with each other families that are going through the exact same thing that they are. Folks who have the same age of kids sometimes get tips on parenting and whatnot from each other. But we really talk about grief and loss and trauma and attachment. We talk about the core issues in adoption. And so from the viewpoint of the child, the adoptive parent, and the biological parent. So we split our whole group into 3 different groups, and they will need to talk about the 7 core issues of adoption in light of, from the viewpoint of you're the adopted child, or you're the adoptive parent, or you're the biological parent. So sometimes it really helps folks see things from a different lens and get the full picture of adoption. The activities are really designed to help walk parents through what it might be like. And so one of the activities that we do when we get to do it in person, and we've even figured out how to do it with breakout rooms on Zoom, is we will put folks in to separate rooms in groups, small groups, and then have them talk about, what is attachment? Are there stages in attachment? And so have somebody be a recorder, and they will start getting into this whole discussion, and then we'll move people out of the room without much explanation whatsoever. And so we put them in a different room with a new group of people, and by the end of it, some people catch on, but they really have this aha experience of what it must be like for a child in foster care to get moved from home to home, and what the different expectations are. And we have them share their initial feedback. Sometimes people get moved more than once. So we also have an adoption triangle panel. So folks, an adoptive parent and a child who was adopted, and a birth mother who placed a child for adoption. And then from our own caseloads, we have relationships with adoptive families. And so sometimes they'll come and they'll speak on an adoptive parent panel. And then we have a child psychologist that has worked with us for, probably 30 years. And she really does a whole long question and answer session about child development and behaviors that kids are experiencing, and really this is how you can help your child through this situation. So our post-adoption services we contract with Wayfinder families, and Leslie is our post-adoption worker, and she's been with our office for a long time. She's really excellent about connecting families. So she puts on lots of stuff. She has really excellent trainings that are available to all of us, to foster parents, to adoptive parents, and she runs adoptive parent support groups. They've mostly been online since COVID, but prior to that, she would travel to each of our remote locations and provide families a space to come together and really support each other and get support from her. She offers CEUs to folks for their licensing. And I think what is probably the most fun are the family events that she puts on. So coming up, we have pumpkin patch events. I'm not sure how it's less put together, less of a group thing since COVID, but prior to that, she would have pizza and drinks, and all the families would get together and go to a pumpkin patch and get to commune with each other. All of us are invited, and from our office, and so we bring our families as well, and so it's a very normalizing. They have swim parties, there's a water park, ice skating up in at Mount Shasta. And since COVID, she's been doing like online cooking classes that adoptive families can do together. And she also has special funding, so therapy for families post-adoption who really are struggling and wanting to help their child. Any childcare funding so that they can go to different trainings or just get a little break, things like that. So lastly, how we implement NTI. So our all new workers complete the NTI training. I did the child welfare one and then part of the mental health one. And then we have master's level interns at our office, and so they are also can have the NTI available to them as well. Part of the things that we learned from NTI that we really focus on are the child and family team meetings. That's very important to bring all the players together, I think, and sometimes those conversations can be uncomfortable, but being straightforward and addressing the birth parents, helping them understand, hey, we want you to be successful, and then really focusing on the children and whatnot. Clinical issues, Susan is going to talk about that, and then we really are focusing on helping connect families with adoption competent therapy services. It's really huge. Big chunks can be missed in the therapeutic process if adoption isn't one of the overlays and all of the myriad of things connected to that. So Susan?
Okay, this is our last slide, right, Michelle? Okay, so we're just gonna finish by talking about the clinical issues that we focus on in our office and kind of how we have layered in the NTI training into that. So we do have an existing meeting once a month for 2 hours with a clinical psychologist. I'll call her Dr. Janet. And she's wonderful. Her specialty is and expertise is in child development. So in order to sort of layer in NTI training concepts, issues, activities, skills, I volunteered, or what, did I volunteer, Michelle?
I think you got voluntold.
So thanks, okay. So what I do is I meet with a social worker ahead of the consultation, and we brainstorm that a case that's difficult, that has usually an issue of the elevated mental health needs of the child or children, and possibly sort of a collision of problems with prospective adoptive parents. So, we save our most thorny problems for Dr. Janet, But if we brainstorm ahead of time, I will then take that topic or maybe a treatment modality and paraphrase or condense it, put it on a brightly colored index card, and then I pass those out to everybody ahead of the consultation. So we're already thinking about, for example, post-traumatic stress disorder in preschool age twins. That was one of the topics, and how they were interacting with the father, who we suspected had generalized anxiety disorder because he was so anxious that we wondered if the increase in the children's tantruming was based on his anxiety. He was trying so hard to be the perfect father, but he had his own personal history of trauma with community violence. So those are kind of some of the things that we would throw into the consultation. And then Dr. Janet will respond. She will talk about the family dynamics, but also the disorder or the types of things that child may need based on not just their chronological age, but their stage, their emotional stage, and what their needs are and what services they would help. So we're really benefiting from, weaving those more thorny issues with the NTI training concepts to kind of we're educating ourselves is what we're doing. And also we might talk about the birth parents, the letter in the NTI training from the birth parent on how to give the adoptive parent and the child support and permission to love each other, and also how to do the good goodbye. And so those are a lot of things that we got from the training that we bring into that consultation, and it really increases our I think our skills and knowledge and our abilities. So to finish, and this is one way our office implements the NTI training, our hope is to stabilize the adoptive families short-term and long-term. And we're just taking responsibility for educating ourselves with the latest evidence-based research, transferring it to our practice. Thanking you, NTI and C.A.S.E, for all the support and opportunity you've given us to increase our work, or the success of our work. Thank you.
Thank you, Michelle and Susan. That's very nice and wonderful to hear about the work that you guys are doing in California. I did have a couple of questions. I know we need to move on, but somebody asked if a family has already adopted a child through your program, do they go through the adoption prep classes again the second time or third time if they adopt through your program, or is it a one-time thing?
Generally, it's a one-time thing unless they might need to go back through again.
Right. Different kinds of issues maybe come up or something in the process. Okay.
Yeah, it just depends. Sometimes folks aren't in the right frame of mind the first time they go through, or it's been like a really long time between adoptions and information has changed, but generally just the ones.
And we had some questions from some folks around whether or not you all address adoptions in cases where a child was born to a surrogate mother. I don't know if that is included in sort of the population of who you work with or not.
I've been here for over 15 years now and haven't come across surrogacy so much as maybe like I had a double donor situation that was, the family, the child was a teen, and the family was very open with it. And
great. Okay. Well, we just thought we would ask because I know that's something that we haven't necessarily focused on, but this field is always growing and changing. So thank you all so much for your contribution. So now we're going to turn it over to Sharon and Etta to talk about what's going on in Massachusetts. So y'all take it away. Sharon or Etta?
Hi there, I'm just waiting for Etta to begin the presentation.
You want Lisa to advance the slide? Lisa?
Okay, let me just text Etta. She may be having some issue with her sound.
Oh, I see. Etta, if you can hear us, if you're on mute, so.
All right,
Others-
now can you hear me?
Yep.
Yes.
Okay. I didn't realize I had to unmute on the computer. I thought I just had to unmute on the phone. But apparently my video is not working. Okay, now it is. All right, great. So if you could just back up to the first slide, Lisa, please. Thank you. Okay, so good afternoon, everybody. Sharon and I are delighted to be a part of today's presentation. Thank you for including us and asking us to participate. We're excited to be able to share a little bit about NTI implementation in Massachusetts, especially in relation to promoting family stability. Okay, next slide. So we thought it would be helpful to give you a little bit of information about the context in Massachusetts. Permanency, especially long-term family stability, whether it's for intact families or children who are returning home or children in adoption or guardianship placements, is one of the Commonwealth's highest priorities. The governor of Massachusetts implemented an Agile Scrum management tool for most Massachusetts agencies early in his tenure. I don't know if you've heard about Agile Scrum, but it's pretty specific and it comes from the computer industry. But it's been in effect for DCF since 2016. And one of our agency improvement leadership teams is the Permanency team, originally formed in 2016, and Sharon and I are now the current co-captains of that team. NTI is entirely consistent with our Massachusetts permanency priorities. Within the past 2 years, we have redesigned our initial placement review process, which happens in about 6 weeks after a child enters placement. It's now aligned with NTI. And we are in the process of redesigning our permanency place planning conference process, which happens later in the process, somewhere between 6 and 9 months after placement. Okay, next slide. This is our agenda for our presentation. I won't read them all, but here's what we plan to cover during our allotted time today. And you'll see that there's some consistency with what our colleagues from California have talked about, although ours is a slightly different approach to these subjects. Okay, Sharon.
Good afternoon, everyone. And it's a good thing that we're consistent with Michelle and Susan, otherwise it would be pretty embarrassing. So, in looking at the lifelong process of adoption, let's just think about the basics. Who are we? How do we see the world? And how does it affect how we interact with the world? Let's watch this quick video. Looks like we might have a little technical difficulty.
Okay,
There
we go.
So this cute video illustrates so much. This little girl's life experiences affect how she interprets objects and cues. Everything is a hand sanitizer. Then, even though she doesn't get the expected result, no hand sanitizer comes out, she reacts the same way as if it did. She rubs her hands together. We know why she's doing what she's doing. So think of our kids, their early life experiences, how they relate with the world. We have to work to understand how to help them navigate this. How many times have we heard a parent say, I don't get it. I've never done such and such, or said such and such, but why does my child still keep doing that thing? Next slide. So we have to remember that what went before does not simply cease to exist for the child. The first family and early life experiences are always a part of who the adopted person is. It's always a part of who we are. We need to help our kids make sense of their stories throughout their developmental stages, including adulthood. We need to honor and acknowledge previous attachments and relationships. This is inclusive of cultural and ethnic influences and life experiences. So to navigate this journey, we need to know and understand both the child's and the parent's triggers, past trauma. Traumatic experiences can result in survival behaviors like hoarding, stealing, lying. Edna?
So while this is not an exhaustive list of what we think, these are qualities that we think are among the most important ones for successful foster, adoptive, and kinship parents. We're in the process of revising our home study assessment, and these qualities are among those that we're looking for as we evaluate. And you'll see that these are some of these are consistent with what California had to say. And sense of humor is our second bullet. Next slide. So, oops, sorry. So how does Massachusetts help? Well, for one thing, we have a parent leadership training program that we have contracted through NACAC. It's a 6-session series, and it deals with effective group facilitation, parent engagement, trauma-informed parenting strategies, fetal alcohol spectrum disorders, virtual support groups and networks, and understanding the impact of ACEs. We recognize the need to invest in our parents and staff who are facilitating support groups, and this is a very important part of supporting families. Next slide, okay. We had originally planned to hold a permanency conference in the spring of 2020, but the onset of the pandemic wreaked havoc on those plans. So instead, we launched a series of 10 workshops that are listed here. You can see that the topics all relate to skills and knowledge that staff must master in order to assist children, youth, and families in achieving stability and successful outcomes. We believe that it's crucial for families to be comfortable asking for help, knowing whom to ask, and having resources ready before they need them. These are some of the ways we help families, which leads us to post-adoption support, which Sharon will tell you about. Sharon, you're muted.
So what I said was, in Massachusetts, we provide support services through our Adoption Journeys program, and I'll give a little shout out. I did see some Journey staff in attendance here at this webinar. We contract with a private agency, Child and Family Services, that has a statewide presence to provide post-adoption and post-guardianship support services. Journey started in 1997. 66% of the Journey staff have participated in NTI. Any family who resides in Massachusetts and has finalized an adoption or permanent guardianship can participate in services. The department is committed to all families, whether they adopted domestically, internationally, from the public or private sector. Next slide. All families and professionals, oops, that's okay. You don't need to go back, Lisa, my mistake. All families and professionals that call the 1-800 line are provided a parent guide to services. Adoption workers can also provide it to the family prior to finalization. Families can participate in any or all of the services offered by Journeys at any time during their post-adoption experience. And services include information and referral. We have a 1-800 line that has coverage 24 hours a day, 7 days a week. We also have our regional response teams. Massachusetts is divided into 5 regions, and there is a team assigned to each. There are up to 3 members of a team that can respond individually or together. The teams can provide brief preventative services up to intense stabilization. Teams are frequently utilized for advocacy and coordination of services. They can assist families in developing plans that recognize their family's strengths, resources, and needs. Although we recognize that the family is the expert, in times of stress, it may be difficult for families to recognize and apply their own expertise. That's where Journeys comes in. Journeys also uses a family advocacy and support tool, the FAST, which ensures better communication and collaboration between the family and Journeys. It also helps to clarify goals and objectives, easily identify their progress, and to see what work needs to be done. Journeys also has parent liaisons or mentors. These are mentors for families that have been there, done that. We also have support groups, different types of groups: parent support, psychoeducational groups, children's groups, adolescent groups. We also have respite. Respite is meant to be planned and not in response to a crisis or used in a punitive way. It can assist family with an unexpected situation like a death in the family or illness that the family needs to travel for, or whatever that may be. But respite is meant to be a family support and is not typically provided in the traditional way where the child leaves the home and stays elsewhere. As we all know, the traditional type of respite can often wreak more havoc than what the benefit is in having our kids feel very abandoned and the sense of loss yet again. We have also child recreational respite, where a group of kids participate in an activity. Being in a group where the unspoken understanding is that everyone there is adopted offers a great relief. Frequently, it is the only place where kids see other families who may look like theirs and have similar experiences. No one needs to explain why they are not the same race as their family or siblings, or answer questions that are intrusive. Respite can come in the form of family social recreational respite, much like what our California colleagues mentioned. In addition to normalizing the adoptive family experience and reducing isolation, family respite events allow adoptive families to remember to relax and play together. Many adoptive families feel like they work all of the time on correcting behaviors and struggling with specialized needs. Social activities can provide a sense of community, acceptance, empowerment, and normalcy. We also have some childcare respite that can be provided in the family's home, in the childcare provider's home, or in another designated setting. Next slide. Adoption Journeys also has a mandate to provide training and case consultation to professionals in the community to become more adoption competent in their interactions with our kids and families. Journeys, in collaboration with the Massachusetts Adoption Resource Exchange and Dave Thomas Foundation, also has provided several cohorts of over the past several years of the training for adoption competency, also through C.A.S.E, also known as TAC. Next. So aside from Journeys, we know that families need adoption competent mental health services, and that not all help is helpful and can actually be harmful, especially if they don't recognize the impact of resurfacing trauma experiences without having a safety net or plan for the child and the family. And we encourage our contracted vendors to participate in NTI. Edda?
So next slide, please. Thank you. How has NTI changed or impacted our practice? We've received feedback from a number of DCF staff and community providers who've completed or are in the process of completing NTI. And what we hear from them is that NTI increases their sensitivity to making sure that children and youth are really well prepared for permanency. That transitions don't happen quite as quickly, that people are much more sensitive to whether or not the child is him or herself ready. In addition, we're revising our foster parent preparation program, which is MAP, Massachusetts approach to partnerships in parenting, to align with NTI. We're in the process of doing that now. And as we already mentioned, our initial placement review, which happens at about 6 weeks, those meetings and our permanency planning conferences are aligned or aligning with NTI. Slide. So we find that the resource materials included with NTI provide invaluable ongoing assistance and support. People don't just use them during the training itself, but they download them, they keep them, they save the materials, and use them throughout then the process of their casework. There's more use of life books and greater commitment to preserving children's histories, which in turn means that families have greater capacity to answer children's questions and understand children's behaviors, including the behaviors such as we saw in the video at the beginning of our presentation. If you didn't have an understanding of why that child was doing what she was doing, then it would be pretty puzzling behavior. Next slide. Challenges that we've experienced. Well, the first one was that our learning management system in Massachusetts was archaic and not even remotely capable of handling NTI, although we did try it. So our staff are all registered through NTI, which is working extremely well for us. And as probably all of you have experienced as well, the pandemic and associated challenges made it much more difficult for people to want to take on NTI or any other new project, especially considering the significant time commitment of 20 to 25 hours. Next slide. But in spite of those challenges, we are having great successes, significant successes. Massachusetts included NTI in its response to a recent high-profile case that was reviewed by the Office of the Child Advocate, and we had to do a response. And the legislature and various other folks are holding us to it. NTI was among the solutions to some of the issues that were cited. NTI was integrated into our 5-year annual performance service review, better known as APSR, for the feds. Many of you are probably very familiar with those as well. And we have managed to achieve traction in spite of COVID challenges. We've been delighted with the positive response from our contracted providers and from community organizations. And Sharon mentioned specifically the Journey staff, 66% of the staff having done NTI. So we've had terrific successes there. Next slide. How we're approaching sustainability. Any new program requires a commitment to sustainability if it's going to be maintained successfully. And we've created new permanency positions. We've created job descriptions for them, and we'll be posting and hiring soon. And the responsibilities for those positions will help to sustain NTI implementation. We're also implementing coaching for supervisors, and we're working collaboratively with our training institute to make sure that DCF trainings are consistent with NTI. And perhaps most importantly, we have complete support and enthusiasm from our commissioner, who just thinks NTI is terrific. Slide. We also have a 5-year plan for spending adoption incentives and other federal funding that incorporates addition of services and positions that align with NTI principles of learning. All of these things relate to providing services to families and supports to staff that will enhance good practice and will promote family stability. And that brings us to the end. Any questions on anything we've covered?
Oh, thank you so much, Sharon.
Or anything we didn't?
I'm sorry, you go ahead.
I just said, or anything we didn't cover.
We had one question. Somebody had asked whether or not the trainings that are part of your permanency, the 10 workshops, I think, whatever that you provide, are those open to people outside of your system? Are there recordings or anything that you heard, or?
So we have recorded some of them. They are open to people who are external to the department, but part of the system. So their contracted providers are welcome to attend. Community agencies that we work with are welcome to attend, but it's not open to the general public. It is DCF and DCF related folks.
Right. Okay. That helps. Thank you very much. All right, Lisa, I'm going to turn it back over to you. Thank you so much again, Sharon and Etta. We appreciate it.
You're very welcome.
Okay, so were there any other questions that you'd like answered? You could just put those in the chat and we'll try and capture those. I'd like to say thank you so very much to Sharon and Etta, Michelle and Susan. This has been a really great presentation. I appreciate all the ways that you have talked about incorporating NTI, the different people loved your video, the little video of that little child, just too adorable, and a great metaphor, right? I loved that. And I also love the starfish metaphor, pulling a starfish off of a rock and they lose suckers and then it's harder to attach every time. I think that's a great visual. So really appreciating your presentations and your comments. So, and how to put NTI into practice. That's our hope here at NTI, that not only are people taking the training, but are incorporating it into the day-to-day surface. Understanding that adoption, competent mental health services, child welfare services can go such a long way to maintaining the stability for children, youth, and families.
Lisa,
yes.
Lisa, I'm sorry. We do have a question that's about our national directory. How do you get on it? How do you access it? And those kinds of things.
Okay, well, I'm getting there. Thanks, Edna.
All right.
All righty. Yep, adoption competency helps save families. We've talked about that. NTI, you've heard this, supports children in healing from trauma and loss, provides parents with skills to parent effectively, and does help to improve child and family well-being. I think our presenters had talked about this a bit. We're going to get to how to get to the directory in a moment. But first of all, if you are one of those people who haven't yet taken NTI, it is super simple to get there, super simple to take this training. Just go to our website, adoptionsupport.org/NTI, and click on one of these buttons, either access to the case LMS. You can access it through your state if your state is a host. And there's a list of our host sites on our website, or you could access through CapLearn. But super simple. And then if you are having any struggles in getting access to NTI, we can certainly assist you. And our information is on the last slide. We'll be there in a second. How do you get on the National Directory of NTI trained professionals? So first of all, you have to complete NTI, of course. And then at the end of it, you're just going to go to this link on our website, and you're going to upload your copy of your certificate of completion. Put in all your information, and Karen Meyer, our marketing whiz, is going to help you become listed. And then for your folks, anybody who's looking for an NTI trained professional can go to that site and type in a state or a person's name, or just look at the entire directory in order to find a professional to help who we really consider to be adoption competent. Not certified as adoption competent, but who's completed the training and has at least that foundational knowledge of.
And Lisa, just a clarification that this directory is really intended for the mental health professionals who have completed NTI. So if people who are looking for a therapist, mental health professional, this would be where you could go to find one.
Great, thank you. Okay, do we have any more questions about any of it? I see Desiree had asked the question, is this, would this benefit a guardian? Absolutely. I think this would be very applicable to guardians, for sure.
Like guardian ad litem's or CASES, yeah.
Or a parent who's a guardianship parent, right?
Right.
Mm-hmm. So any of those, for sure.
And Richard makes a great point. To be competent requires lifelong learning. So of course, that's the reason that we say we're not certifying folks into be adoption competent. We recognize NTI is a great starting place. It provides a really strong foundation for understanding and addressing the needs of families. But all of us are lifelong learners. So we want to continue to grow. And it's one of the reasons that we hope the feds will support our efforts to continue to update this training over the years so that it remains robust and up to date and addresses the trends of the day.
Okay, so if there are no more questions, are you seeing any more, Edna or Don?
I'm looking, I don't see any more that we haven't already addressed.
Yeah, no more questions. But that folks want to know how they get their certificate of participation and do their evaluation, Lisa.
Okay, well, they'll be getting a link as soon as we sign off here, and you'll be able to do the evaluation and get your certificate of completion. That's an automatic email that goes to everyone. So this concludes our Transfer of Learning Tuesdays series, our TOLT as we've been calling it, because in this business, we love acronyms. And really, again, appreciate Susan and Michelle and Etta and Sharon and all of you who have participated in this training. Thank you to Tiara, who is our technical expert, Don and Edna. I appreciate your support and your participation and your, just everything about you guys, of course.
Really quick.
Yeah, go ahead.
We have one question.
Okay.
Do both modules need to be completed? So if you're taking the NTI training for child welfare professionals or supervisors or mental health professionals, you don't have to do all three. You just choose which curriculum you want to use and you complete that entire curriculum, and then you'll get your certificate of completion for NTI.
Great question, thanks. we have all of our previous TOLT webinars on demand. You can find those at our website, adoptionsupport.org/NTI. And this one will be up there as well. The links will be, you'll have a link to the PowerPoint presentations and the resources that are included within those. And anything that you need that you haven't seen or haven't heard from us, please do give us a shout.
And
Dawn
Lisa,
and I and Edna are happy to.
there you go. I was going to
there you
ask for their contact information. If there's anybody out there who wants to be a host site for NTI, you are an agency leader in an organization, a state department of, DSS or Child Family Services, you want to bring NTI to your community, please reach out to us, and we would love to have a conversation with you to bring NTI to your community of professionals, so that we can, really expand the network of professionals who have this, what we believe is really strong foundational training around the needs of children and youth and their families. So thank you all for your time and attention and for your support of NTI. And again, to our wonderful presenters today, Sharon, Etta, Michelle, and Susan, thank you so much for your efforts and sharing, what's worked well for you. So thank you.
Thanks, everyone. Have a great week.
Thank you.